Hi, and welcome to our NUR2106 group presentation. Today we'll be discussing a typical patient with Graves' disease. I'm Keith, and I'll be discussing the pathophysiology.
I'm Mahnoor, and I'll be talking about the pharmacological interventions.
I'm Brendon, I'll be doing nursing interventions.
So our patient is Jane Butler. She's a 35-year-old Pakistani woman. She's got a slim build. She's married and has 2 children. And she's a part-time substitute teacher. She's reporting high levels of stress and smokes half a packet of cigarettes a day. She's been diagnosed with Graves' disease, a form of hypothyroidism.
Hi Jane, I'm one of the nurses from Monash Medical Centre. We just came to double check in how you're doing. Now you've recently been diagnosed with Graves' disease, is that correct?
Yeah.
Do you know anything about that?
No.
No?
No.
No, that's unfortunate. Graves' disease is a type of hypothyroidism. In hypothyroidism, the thyroid gland, which is in your neck, starts producing way too many of the hormones that control your metabolism, your nervous system, and you start feeling really flustered and funny. The thyroid gland sits kind of about here. It's butterfly shaped. It's stimulated by a gland in your brain that releases hormones to it to tell it to release other hormones. In Graves' disease, some of your antibodies start activating the thyroid gland instead of the other hormones from your brain.
Okay.
Does that make sense?
Yeah.
Yeah. So some of the symptoms that you've probably been experiencing already or might experience in the future could include a racing heart.
Yeah.
We call it tachycardia. Loose or soft poo. I know it's difficult to talk about, but your gut will start being a lot quicker. Shaky hands. You could gain or lose weight. You could start eating a lot or stop eating at all.
Yeah.
You could have hot flushes. You could stop being able to deal with heat as well as you used to be able to, like get really hot really quickly.
Yeah.
It can also cause, and in some cases, the thyroid gland to start to swell, and it'll be painless, but it will start getting bigger and bigger around your neck. So we're just going to have to keep an eye on that just in case that happens, but it shouldn't be an issue because it hasn't obviously yet.
Yeah.
And also you might get a little more irritable than you used to. Is that making sense?
Yeah, it is.
Do you have any more questions about what Graves' disease exactly is?
No, not really. You covered it all.
Alright, thanks Jane.
Thank you.
The thyroid gland is responsible for regulating metabolism and the sympathetic nervous system. The anterior pituitary gland releases thyroid-stimulating hormone, otherwise known as TSH. TSH stimulates the thyroid to release thyroid hormone, which consists of thyroxine and triiodothyronine. Together, these hormones are responsible for regulating metabolic rate and anabolism and catabolism in most body systems, most notably the sympathetic nervous system. Graves' disease is a type of hypothyroidism, and also an autoimmune disease. In Graves' disease, the body produces antibodies that bind to and constantly stimulate thyroid-stimulating hormone receptors on the thyroid gland. As these antibodies are not thyroid-stimulating hormone, the enzymes present to break down TSH do not break down the antibodies, and they stimulate the thyroid for a much longer period of time than TSH would. This results in a significant increase in the thyroid's release of T3 and T4. This results in increased stimulation of the sympathetic nervous system and an increased metabolism. A fairly common symptom of Graves' disease is Graves' ophthalmopathy, in which inflammation causes bulging of the eyes. This can coincide with eye pain and sensitivity to light.
There are 4 types of drugs that can be used to treat Jane's hypothyroidism. So the first one is propylthyrosol. Propylthyrosol is an antithyroid agent, and what it does is inhibits the synthesis of T4. T4 is a hormone that helps control essentially everything in your body. For example, the body's metabolic rate, which helps explain Jane's weight loss and increased appetite. It also plays a role in the heart and digestive functions, which explains Jane's tachycardia and diarrhea, as well as muscle control, which helps identify why Jane's muscles are weak. And lastly, brain control, which helps explain why Jane is stressed and anxious. Propylthyrosol stops the conversion of T4 in the peripheral tissues, and by inhibiting Jane's T4 levels, it will help slow down her body's function and, as a result, help relieve her from her symptoms. So some contraindications are pregnancy or breastfeeding, taking anticoagulants and beta blockers, and being allergic to the ingredients in propylthyrosol. Propylthyrosol can cause some adverse reactions such as upset stomach, nausea, headache, joint or muscle pain, and the changes in the amount of urine. So some safety and monitoring considerations. Liver toxicity is a major concern with propylthyrosol. So to make sure that Jane's liver is not affected, we need to monitor her liver functions. This will be done by testing her bilirubin and alkaline phosphate levels. We also need to monitor Jane's hepatocellular integrity, and this will be measured by ALT and AST tests. Patient education is also required to identify symptoms. This means encouraging Jane to look out for sudden weight loss, right upper quadrant pain, and if Jane experiences any of the symptoms, she will need to discontinue the use of propylthyrosol. Propylthyrosol can also cause hypothyroidism, so to ensure that Jane's hormone levels are in the norm, close monitoring is required. So another drug that can be used to treat Jane's hypothyroidism is methimazole. So methimazole is an antithyroid drug. And what it does is it works like propylthyrosol, so it works by reducing the levels of thyroid hormones. This is again done by inhibiting the synthesis of T4 and T3. So some contraindications are hypersensitivity, allergies to the ingredients in methimazole, and a decrease in blood functions. Adverse reactions are drowsiness, headaches, nausea, and fever. Safety and monitoring considerations. A consideration that needs to be taken into account is methimazole may cause a granulocytosis. So granulocytosis is a condition where the white blood cell count is dangerously low. In order to make sure that Jane doesn't develop a granulocytosis, regular blood tests need to be taken during the treatment process to make sure her white blood cell count remains in the normal range. We also need to monitor Jane to identify any signs of hypothyroidism. So for this, patient education is required so that Jane is able to identify some of the symptoms herself, such as cold intolerance, constipation, dry skin, and weakness. Lastly, we will need to do regular skin assessments to check for swelling of lymph nodes. Propanol is another drug that can be used to treat Jane's hypothyroidism symptoms. So propanol is a beta blocker. And what it does is it plays a role in heart and circulation of blood in arteries and veins. It works by slowing down the activity of the heart by stopping messages sent by the nerves to your heart. This is done by inhibiting beta-adrenergic receptors, which ultimately slows down heartbeat. Propanol is also used to treat migraine headaches, and because Jane has been having a few migraines, this will help her feel a little bit more comfortable. So some contraindications of propanol are asthma, slow heartbeats, and thyroid disorder. So this means that because Jane has hypothyroidism, close monitoring will be required to make sure that there aren't any severe adverse reactions. So some adverse reactions of propanol are slow and uneven heartbeats, lightheadedness, shortness of breath, depression, confusion and hallucinations, and sleep problems. Safety and monitoring considerations. So small doses of propanol will be given to Jane to test the pharmacodynamics. It is essential to make sure that her heart rate does not decrease below average, so vital signs will need to be checked regularly. Jane may feel very tired whilst on propanol, so patient education will be required to help Jane understand the importance of avoiding driving whilst on propanol. Jane may also become intolerant to cold climate, so to help Jane, we will need to provide her a comfortable environment to help reduce intolerance to cold weather.
Hi Jane, I'm Brendon, your treating nurse.
Hi.
So I just need to clarify a few things with you. I've consulted with the doctors. We'll be giving you radioactive iodine.
Yeah.
It's part of the sodium iodide drug class.
Okay, what is that?
So it'll be administered to you in capsules, and its purpose is to shrink your thyroid gland physically.
Oh, okay.
So in some ways it can permanently destroy the thyroid gland, but I know it sounds quite drastic, but it's actually quite a common treatment.
Oh, okay.
So I'll just have to ask you a few questions relating to that. Is that okay?
Yeah, that's fine.
So are you pregnant or breastfeeding?
No, I'm not.
Do you have any cardiac or kidney issues?
No, I don't.
Okay, so sometimes you might get some neck tenderness, some swelling, nausea, there might be some of the adverse reactions to it.
Okay.
Your menstrual cycles might also become a little funny, like it might become a little irregular from the normal.
Oh, okay.
Yep. So just for preparation, we'll need you to fast until after midnight. Then we'll get you to come into the clinic. You have to stop taking any of the medications you're currently taking.
Okay.
And then you'll be able to go home after the treatment, but you should avoid any prolonged contact with anyone. Is that okay?
I don't get what that means.
So that means you'll need to stay in a separate bed if you have a spouse or children. Also, you'll need to shower somewhere else. You'll need to avoid. You'll be emitting radiation, so we'll need you to stay away as much as possible.
Okay. Yeah.
So yeah, do you have any questions?
No, that's all.
Okay, cool.
Yeah, thank you.
So no problem. Yeah.
As nurses, we are caring for the patient's overall well-being, so there needs to be interventions concerning the holistic health of the patient. These interventions are aimed at supporting the patient through the crisis and helping the patient cope with the stressful event that precipitated it. In Jane's case, there are specific nursing interventions relating to a hypothyroidism that can positively impact her recovery. Interventions that can assist the care of Jane's hypothyroidism include the following: diet advice and monitoring, maintaining cardiac output, establishing therapeutic communication, and patient education. The link between diet and hypothyroidism is the substance iodine. By limiting it, it is possible to prevent overproduction of the hormone iodine. As the treating nurse working alongside Jane and the dietitian, it is possible to come up with a diet suitable for her at the hospital and at home. Cruciferous vegetables naturally release a compound called goitrin when they're broken down. Goitrin can interfere with the synthesis of thyroid hormones. It is present in foods such as broccoli, cabbage, turnips, or kale. As the treating nurse, it is important to equip Jane for life post-treatment. She will require lifestyle changes to adapt to the introduction of goitrogenic foods and to adapt to this new diet. The following behavior modification techniques discussed with Jane may help her maintain her weight, as recommended by Alexander et al. 2017. Limiting food intake to one area at home, keeping a food diary, planning food intake for the day, sitting down at the table to eat all her food. Uncontrolled hypothyroidism leaves room for the risk of decreased cardiac output in Jane. Therefore, levels must be monitored to maintain Jane's cardiovascular health. The aim is to maintain adequate cardiac output for tissue needs, obtaining stable vitals. The absence of dysrhythmias and a proper ECG recording will help indicate stability in Jane Butler. Blood pressure. Orthostatic hypertension occurs due to peripheral vasodilation and a decreased circulating volume. A higher pulse pressure indicates an increase in stroke volume and decreased systemic vascular resistance. Pulse and heart rate measurements provide a more accurate assessment of normal heart rhythm, as opposed to tachycardia. Action can be relayed to other health professionals who can positively bring back her cardiac output. ECG, electrocardiogram. Assessing the electrical activity of the heart as it contracts will be useful to observe any abnormalities. Tachycardia may indicate abnormal myocardial stimulation by the thyroid hormone. Any dysrhythmias observed compromise cardiac output and would require intervention. Patient education is an integral part of the job as nurses. When it comes to patient knowledge, they may be deficient regarding the condition, prognosis, treatment, and discharge requirements relating to hypothyroidism, so it would be a requirement to correct the patient on their lack of knowledge or information misinterpretation. This may be seen by their continuous questions, fear of treatment, or a statement of their misconception. The outcome of this intervention would be to ensure understanding of the disease process and its complications, to identify their understanding of therapeutic needs, and to initiate the necessary lifestyle changes that would help reduce symptoms are the nurse's goals. Exercising for up to 30 minutes a day will be a suggestion by the nurse. Hypothyroidism can cause sleeplessness and lower energy levels. The impact of this can be lessened with regular exercise. Explaining to the patient the importance of reducing stress may help relieve symptoms of anxiety, nervousness, poor concentration, and a fast heartbeat. Quitting smoking can reduce her risk of further exacerbating hypothyroid symptoms. It leads to a decrease in morbidity for patients. It is known to increase the risk of Graves' ophthalmopathy, particularly in women. As the nurse, explaining the side effects of medications is also essential to forewarn the patient and work with them to provide therapeutic care. Explain how long it will take to see improvement and how long this therapy will continue for. It is a good idea to keep in mind the patient's feelings and the objective of providing them with a comfortable experience. The ability to communicate and connect with patients can help build relationships and provide a higher level of care for patients. Thus, the importance of effective therapeutic communication is essential. Patients like Jane may be feeling anxious or scared. To assist her being at ease, some therapeutic communication skills, such as speaking in simple terms, answering her questions, being honest with her, and avoid lecturing her. These may be strategies to gain her trust so that she will work more cooperatively with the nurses. According to Pelletier and Stichler 2014, it may be appropriate to recommend her to a counsellor who would discuss techniques to put her at ease. Discussing with Jane relaxation techniques such as meditation or yoga would contribute to her calm feelings and bolster the therapeutic connection with her.
By consistently applying hand hygiene techniques when approaching and caring for Jane, it is possible to maintain Standard 3, preventing and controlling healthcare-associated infections. There are 5 points where hand hygiene needs to be performed at the bedside in a clinical setting. First one is when you're touching a patient, before clean and aseptic procedures, after body fluid exposure, after touching a patient, and lastly after touching a patient's surroundings.
Standard 4. Medication safety. Maintaining the 7 rights of administering medication for Jane will ensure Standard 4. Medication safety is upheld. The 7 rights have to be taken into consideration. These are right medication, right client, right dose, right time, right route, right reason, and right documentation.
Graves' disease is an autoimmune disease and a type of hypothyroidism. It is caused by the overstimulation of the thyroid gland. There are quite a number of pharmacological interventions that can be used to treat it, but in Jane Butler's case, radioactive iodine was chosen as part of the initial treatment, which helps to slow down the thyroid gland. This is done in conjunction with a number of nursing interventions, including dietary planning, patient education, cardiac monitoring, and, as with most patients, the establishment of therapeutic communication. Graves' disease can have a significant impact on a person's everyday experience of life, but with proper treatment, the symptoms of tachycardia, increased metabolism, irritability, shakes, tremors, goiters, and Graves' ophthalmopathy can be managed often without surgical intervention. On behalf of Mahnoor, Brendon, and myself, thank you for listening to our NUR2106 presentation on Graves' disease. We hope you enjoyed it and maybe even learnt something on the way.